said something to the lady or man that went here when they put him on camera? Did you see what you said? You sit up there. I don't want to talk to you no more.
I don't know what you're talking about.
This one right here.
Does that mean, did you send it?
Bro, look, let me see this. Look. Show him, echo. You see the ring? I know you see the ring.
That's your Snapchat.
No.
Want to see?
To get the link? There should be like a share option.
Somebody put it.
What's this one?
It wasn't, that's not a encoder, different encoder.
Oh.
Yeah, I tried that one. Wasn't you?
Oh, and the white one where you lost. You only won because you made the that's what I was saying.
Echo.
We'll take this section. This section. Taking this section.
I'm out of red. Remember that? I'm out of red. I'm out of red. It's like a big old space right here. You can say on the end right here. You see I'm trying to
These are two questions that I have.
Yeah, move up here. Move it up on the. Hey, don't be giving to him. We gotta move up. Everybody's gotta move up. This row. Need to occupy ladies, move up. Thank you. I'll sit next to you. What? Please move up. Yes. Move up. Ladies, move up. I'm sorry. You have to.
We could be best friends. We could be best friends, okay? Don't talk to me. Let's go to YouTube. Go to YouTube.
No.
Who are you?
Mr. Evans, why you let us move up here?
What?
Why we have to move up here?
So they go for the others. It's the others.
There's no other. You
The
just,
ghost. He's talking about the ghost.
It's good to fill the space.
The ghost.
I don't feel like I'm, people be contagious.
It's the same. You're still next to people.
What happened?
No, but that means I really got to pay attention.
Right.
Exactly. I already don't want to pay attention.
Well, now I can. Now I can make it.
All right, can I have your attention, please? Can I have your attention, please? Okay, thank you. Good morning, everyone. First and foremost, I'm going to introduce myself. I know all of you have seen me here. I'm Ms. Barbero. I'm the new STC coordinator, or Student Transitions Coordinator, and I'm the new WBL assistant. So I'm really excited to be working with you all. And now we're going to introduce our guest speaker. Today we have Christina Lares, who was born and raised in Central Coast, California, in the city of Ventura. She is a proud daughter of teen parents. Throughout her life, Christina was very observant of the oppressive conditions her family and community faced and questioned if another world was possible. During her undergraduate and graduate career at San Diego State University, Christina joined various and community-based organizations and achieved the power of organization in achieving lasting and meaningful change. As Community Engagement Manager with California Latinas for Reproductive Justice, Christina is continuing her commitment to her community by empowering and creating a base of Latinx leaders in the reproductive justice history, its framework and practice in order to support and advance reproductive justice issues for themselves, their families, and their communities. When she is not working on research projects or community organizing, she is training as a competitive aerial artist and teaching other women how to feel empowered through movement and dance. So if you please give a round of applause for Christina.
Thank you so much, and I again want to thank Ms. Barbero for inviting me to be here. Ms. Barbero and I know each other from a lot of our activism that we do in the community, so I'm really happy to be here and speak with all of y'all. My name is Christina Lares again. I am a Community Engagement Manager with California Latinas Reproductive Justice. So before I talk about what I do, I'm going to talk a little bit about who I am and what brought me, to this point today. I'm like my intro said, which I'm sorry is a little bit poorly written. I'm sorry about that. I was born in Ventura, which is about an hour north of here. So if you're going up the coast to go to like the beach in Santa Barbara, there's a small little town over there, and that's where I live. I lived on the west side of town, which is mostly a Mexicano, Chicano neighborhood, low-income, working-class neighborhood, in a mostly white city. So it was a little bit difficult growing up. A lot of the schools that I went to were under-resourced. We didn't have a lot of the resources that we needed. It was, having to do things on our own. And then, growing up high school, middle school, and then trying to get to college, it was difficult. And a lot of the times I blame my parents for for the conditions that we were living in. I blamed my parents for not being around when I wanted, their help with stuff. I blamed them when I had to stay with other family members in order to take care of us. And it wasn't until I went to, I had the privilege of going to the university, was when I started really learning about the conditions that my community were experiencing. Weren't the direct fault of my parents, but oftentimes the result of a lot of environmental factors that were kind of stacked against working class communities, communities of color, and where I was from, mostly Mexicano community. What else? I was really lucky to have folks growing up. I had older uncles, I had aunts who were able to kind of show me the way when I went to school. And I think that's really important in my personal success as just an individual, to have mentors around that were really supportive of me and really showed me another way. I had a lot of mentors that were involved in the gang life. My parents were involved in the gang life. So that was something that I looked up to for a long time. That was something that I really wanted to be like, to the point where I was like in middle school and I did the eyebrows, I shaved them off, and my mom, she got really, really mad at me for doing that. But because that was what was around me, that was what I saw as something to strive for, they were respected, they had a lot of power, they had a lot of things, so I felt like that was the route I needed to go. But it wasn't until I had an older uncle who was able to go to college. I had another aunt who got sick at the time, and my family kind of got to rally together to really help her, and it really changed us and brought us together. And that's where health, became something that was important in my family and a career path that I thought I could achieve. So my aunt had cancer. We were coming back and forth to the Children's Hospital here in LA to go to treatments. We would stay overnight with her, and it was really close. It was really scary. She was 12 when she got sick, and she didn't get out of it until she was 18. But coming to the hospitals, I was introduced to the hospital environment. I was introduced to nurses, social workers, things like that, and I always thought it was really interesting to be able to help people. That's something that I always knew that I wanted to do. As a young person, I wanted to be a pediatrician, which is a doctor, for children. I really enjoyed going to the doctor and getting a sticker, from the doctor, or a lollipop or whatever from the doctor, and the nurses, that were there to help me. And so that's what got me oriented to health. Luckily, throughout high school, I had a lot of support. I was able to get access to AP classes, honors classes, the SAT. It wasn't easy. I really had to look out for those resources on my own because the school wasn't, my high school counselor told me, and this is something that I remember still to this day, and I'm waiting for the day to go see him again and throw my degrees in his face. But my high school counselor told me, as I was trying to figure out what I wanted to do in my sophomore, junior year, looking at my grades, I had pretty good grades, B's, C's, A's, there. And he told me not to apply to UC universities, the University of California, UCLA, those types of schools, because he said, don't waste your money, you're not going to get in, don't even try, because of the way my grades looked or whatever he perceived as. And I listened to him, and I didn't. And that's something that I regret, for listening to someone who told me I couldn't do something, because now I was able to go to San Diego State University. I was able to get my bachelor's degree there in health science. I studied public health there, and I was able to continue my education to get 2 master's degrees at San Diego State as well. So that just goes to show that some people may think that you cannot achieve certain things because of the way you look, or the neighborhood you come from, or the language you speak, or the traditions that you have in your family, whatever their perceptions are of you. But you can achieve whatever you like. It is hard work, but you can do it. And so that's what got me to San Diego State. I was really a rebellious kind of young person. If somebody told me I couldn't do something, then I was like, okay, I'm gonna do it anyway. I don't care what you say. Got me in a little bit of trouble, but I always knew that I wanted to be better than the experiences that I had as a youngster. I always told myself that I wanted to be better than my parents. I wanted to be better than my cousins or those around me. And as I got older, I realized, the struggles that we faced weren't about them. It was about the fact that certain parts of our community, we weren't getting access to resources. We weren't getting access to the money that we needed so that we could all have a good education, so we can all live in a safe environment, so we can all be whole. And that wasn't until I went to college when I started learning about ethnic studies, when I started learning about my own history, And that really empowered me to see like, oh wow, like my community is beautiful. The people that I live around in my community are beautiful. We have a rich history. We come from a history of struggle. And I should be proud and not ashamed of who I am. I should be proud of who I am and want to give back to my community to help others so that they can rise up and be successful and to their full potential. And so I decided I first went into San Diego State studying psychology. You know, a lot of the friends that I had were like studying psychology at the time, and that was like a generic major that you could do just to kind of go to college. Then I decided to study nursing, which is really, really intense program at San Diego State. It's very competitive. You have to take a lot of, organic chemistry, biology, anatomy, like very, very science-based classes. It was very, very tough. But there was a shift in my sophomore year. My grandfather got very, very sick very quickly, and unfortunately he died a few weeks after he had a stroke very quickly in my family. And it kind of changed the way I looked at health and the way we treat our people. You know, we went to the hospital. There were tons of nurses that were there that were helping him, trying to make him comfortable. He wasn't really going to make it, so they tried to make him comfortable on his way out. And for me, seeing these nurses that do very important work, it was great, but it was too late for my grandfather. You know, he had diabetes. He had some health conditions that he wasn't able to get treated because he had language barriers, cultural barriers, that he didn't feel welcome in the health environment. You know, he was turned off to it. And so I felt that that's when I learned about public health. And public health is a whole other field where we do health education, where we look at health as a prevention. So instead of having to treat people once they're sick, we talk to them before. We analyze environments, and we try to keep people healthy and keep them from getting sick. And so that was something that really resonated with me because, again, like I said, growing up, I was really conscious of my social environment and the conditions that we lived in. And so I was very social justice minded. And in public health, there's kind of a social justice element in that you're really trying to empower people to take control over their own health and demand the resources that they need from the environment around them. So it really aligned my interests with my community and my career interests in this field of public health. And so I stayed at San Diego State. I graduated, like I said, with a bachelor's degree there. And then I stayed there to do a master's program, so a graduate level program to advance my studies and just kind of position myself a little bit better as I try to get a job, something so I could be in a leadership position, is why I went to graduate school. And there they had a very special program. So this is, if those of you are interested in staying in California, a very cool program where it's a Master's of Public Health program, also combined with a Master's of Arts in Latin American Studies. So you are studying healthcare from a Latin American perspective. So you're studying, health. You're learning about how to, give the best health education classes. You're learning about how to, do surveys in the community, how to do research. But also you're learning about sociology. You're learning about anthropology. You're learning about the conditions that create, health and community. You're learning about culture and how that influences healthcare. So it was very, very interesting to me. I even had the opportunity to take some classes in Tijuana. There's a couple universities in Baja California that are very, very prestigious medical schools and things like that. So I was able to go there to also take some classes there with those students. And so I was able to do a little bit more. So I highly encourage y'all checking out San Diego State, home of the Aztecs. If y'all are interested, it's a great school, great environment. A lot of clubs on campus that you can get involved in. It was really difficult to go to college because it's very big campus, right? And you feel very small on a campus, especially as like a Chicana, Mexicana girl. It was really hard to find folks that kind of vibed with me and were from the same environment. And luckily I found some student organizations that were, folks that were just like me, that, coming from a small neighborhood, trying to get out, trying to do the best you can, trying to be successful, and doing that together and finding support. So definitely, I highly encourage folks to get involved in student organizations, student groups, starting your own groups if you see that there's a lack of it, even now. So that's really my educational background. So if y'all have questions on kind of like schooling and what motivated me, we can talk about that later. But what brings me to this position today and what I do today as a working at California Latinas for Reproductive Justice. So reproductive justice. Has anybody heard of that term? Reproductive justice? Reproductive health? Have you heard that? Reproductive rights? How many of y'all heard of organizations like Planned Parenthood? Right? Y'all heard about that? Some of y'all watching the news, listening to what's going on. There's a new administration, and they're trying to cut back health right now. So that's something that, as an organization, we pay a lot of attention to. We do health advocacy work, which is, y'all ready? Okay. We do health advocacy work. So Planned Parenthood provides services for folks. They provide, access to reproductive and sexual health care. So, birth control access, sexual health screenings, STD screenings, cancer screenings. They also provide counseling. They also provide kind of like social work services to provide you to somewhere. As our organization is more of an advocacy group. So we don't provide services. You can't come to us and try to get, a clinic visit or see a doctor. That's not what we do. What we do is really talk to folks in the community and see what their needs are and develop those needs into policy. And policy are laws that we have at the state level that help us, reach the healthcare that we need, help us be healthier people, support our communities. That's what we do. We go to the state legislature. We take groups of folks. We could take some of y'all if y'all ever wanted to go and have that experience of what it's like to go to Sacramento to talk to our representatives. These are folks that we voted into office and really hold them accountable to the communities that they serve and make sure we tell them hey, right here in this neighborhood there's a street, there's a pothole, everybody's car breaks down all the time in this pothole, you need to fix it. It's okay, they listen to the community and they fix it. For us, we look at healthcare issues. We say that in our communities, there's not enough clinics in these communities, and we need access to clinics. We need folks that speak our language. We need folks that understand the needs of our community members. And so we go to representatives here locally or at the state level to really advocate for those laws. What else? Something very unique to the program that we have at CLRJ is something that is it's a little bit controversial for some programs. Is we have a Justice for Young Families program. So a lot of the time we see a lot of teen pregnancy prevention, a lot of monies and education going into preventing teen pregnancy. And for us, and for me especially, coming from young parents, we take a different stance on teen pregnancy and young parenthood. We say that if folks decide to be a young parent, a young mom, a young father, then that is their choice, and they should be given the right to be a parent and given access to the resources so that they're successful. We feel that it's counterproductive if you have a young mom to tell her, okay, well now that you're a young mom, you can't be in school. Sorry, you can't go to college. Sorry, you can't do that. That's not going to be successful for our community. So we have a Justice for Young Parents program that we really try to advocate and really shift the way we look at young parents. Instead of preventing teen pregnancy, we want justice for young families. We want to support young parents so that they are successful. So that's just an example of kind of one of the programs we have at CLRJ. So definitely something very, very interesting and unique, and it really is something special to me because, again, like I said, it brings those two passions that I have together, which is, social justice and working for my community, and also healthcare, health education, and health access. So yeah, that's my story. Definitely, if I can give you any advice, is to really find mentors that are aligned with what you want. You want to find people that are going to lift you up. It's people that have similar interests. Could be teachers, could be family members, could be the guy that works at the corner shop who's always dropping knowledge on you, could be that guy, whatever it is. You need to find mentors that are going to lift you up. And also, try to find something that aligns the passions that you already have. If you love something already, try to find something that's really going to lift up that passion so it's something that you enjoy. Yeah. All right, so if y'all have any questions about anything, my story, my education, the work that I do at CLRJ, I'd be more than happy to
Does anyone have any questions for Christina?
Any questions? Anybody interested in doing maybe health education or doing something like that?
We have a question over here.
Question.
So this student wants to know, what is your position title? And what do you do?
Okay, my position title is Community Engagement Manager. So my job is I make chingonas. I don't know if y'all know what chingonas are. Chingonas is a term that we use at the organization to really empower ourselves, and it's a chingona is like a badass woman leader, and that's my job. So I make chingonas. So my job is to teach people how to, be bold. My job is to teach people how to be strong. My job is to teach people to be fearless and to tell the stories that we have and hold our legislators accountable to our communities. That's my job.
Okay. And another question. You said that you do go to the state legislators, so in Sacramento. Can you describe what that's like? Talking to legislators. What do you do with
Yeah. So our state legislature. So these are folks that we vote into office. So what we do is we make appointments with their office. We try to align with them. So the state is divided into districts. So every neighborhood is a district. Every person has a representative. And so we go to their office, we take a group of people, we practice the things that we want to talk about, and we sit in the office we can sit in the office with the governor, we can sit at the office with some of the state leadership at our level and sit right across from them on a table and tell them exactly what we need, and we tell them our stories. And they then, take our stories and tell them to the other legislatures to pass laws that support our communities and to create healthier communities.
And then, can you also describe what other places you've traveled for your position aside from state legislator?
Yeah.
The state.
So a lot of the work that we do is alliance building. So we find other organizations that are also doing work in the community, maybe immigrant rights groups. We go to them and talk about the work that we do so that they can talk about women's health issues when they're talking about immigrant rights. Because for us, the reproductive justice is a framework that looks at health in a different way. Planned Parenthood organizations look at health as just abortion, birth control, and screenings. But we see reproductive health care as something a little bit wider. We see it as our ability to exist in our community safely, to be able to have children that safely and raise them with dignity, and for us to be able to, if we don't want to have children, to have access to the resources to not have children as well. So it's a lot broader. So then that means we work with immigrant rights organizations because we see these mass deportations, we see these raids as an attack on our reproductive health and our ability to have healthy families. We partner with anti-police brutality groups and groups like that because we feel that the attacks on our community by the police are an attack on our ability to raise healthy families. So we do a lot of working with other groups, traveling to conferences with other groups across the nation so that we can align our efforts and be stronger together in our message.
And we have room for one more question. And I know Christina mentioned before we started that she actually has stuff for students who ask.
Oh yeah.
So what do you have? So maybe we can get some dialogue going.
So folks want to ask a question. I have a limited chingona candle that we made at our fundraiser that we had last year. It has a bunch of empowering terms for leadership. So we made these for a fundraiser we had recently. I also have a Justice for Young Families flash drive where you can save your homework or any of your files. So anybody have any questions and I have a free t-shirt as well. Go ahead.
Do you consider yourself a feminist?
A feminist? I think I consider myself an intersectional feminist. So feminism is I see it as something a little bit broader, like I was just saying. A lot of folks look at feminism as an issue of just women's equality and about women's rights and with the funny hats right now. But for me, feminism goes a lot farther because it is part of my identity, So if we're not talking about immigrant rights, then it's not feminism. If we're not talking about safety in our communities against police brutality, then it isn't feminism. So I would say yes, I'm a feminist, but I am an intersectional feminist. So I highly encourage you, if you want to learn more about feminism and the women of color feminism, I would look up intersectional feminism. Specifically, Audre Lorde is someone that's very interesting to read, if you want more.
There was a question over there.
Question back here?
Do you still want to ask your question?
Dana,
In the back.
don't stand in. What's the name?
What is it? Okay, I saw someone raise their hand over on that side.
There might be something on it you could do.
Okay. That's it?
Any other questions?
Okay.
I have a.
You have to ask a question. That was
Oh, I have a question.
What's your question? Whatever you can.
How do you
have.
feel like you did?
How do I feel like I did in my life?
Yeah.
Like overall?
Overall.
I feel honored, you know what I mean? I feel like it took me a while to get to this point. It was very difficult to find this position, but I set myself up to find this position by doing research, by getting myself on some email lists of things that I was interested in, and now I was able to actually get here by working hard and connecting. So I feel really good. Thank you. Question? She asked if I would still be in this job if I didn't go to the other college. So I remember I said like I went to San Diego State because I didn't apply to other schools. I think that's a really good question because I feel like I'm in this position because I went to San Diego State and I was connected to an organization called MECHA and African Student Union, which really taught me how to learn about my history and the struggles of my community, and that's what got me interested in social justice. So I feel like the path works right for me, like, so I think it worked out better, actually. Yeah.
You just want a shirt?
Free shirt. All right. Yes. My mom was 16 and my dad was 18. Yeah, so they were very, very young, very, very young, and it's very difficult. And I'm 30. So what do we do? All right. Well, I want to thank everybody for your time. If you have any questions after, I have some information here. If you want to sign up, if you want to join us, we're always looking for volunteers to help us with our campaigning and our advocacy. So if you need volunteer hours, come see me. Thank you.
Who's this?
Oh, I want a sticker. I want a sticker.
Okay, I want to stay.
Y'all have that down? So big for
Bro, you got it down.
Get my sticker, man.
They got a bunch of stickers.
It's actually every party.
Extra?
Are you sure? Okay.
I got her for next week.
Sir, your bass is stinking like nuts. Like, no. That was your kid.
Whenever you